Welcome to researchmd.com. Today we're going to talk about the benefit, or how does the mechanism in the extracorporeal shockwave therapy. Remember, we gave a presentation earlier about the extracorporeal shockwave therapy, and today we're going to look at the purpose. How does it produce the effect and the biological mechanism behind extracorporeal shockwave therapy. Again, my name is Pramil Cheriyath. I'm a program director in internal medicine residency, transitional residency, and I also teach medical students and medical residents. I'm also director of research. Now, there's a little bit of background, as extracorporeal shockwave therapy was initially developed in Germany and Bulgaria, and it actually came from initially it was like extracorporeal shockwave lithotripsy to crush the kidney stones. And then this shockwave is focused on the effect on the bones, tendons, and the musculoskeletal symptoms. And it can have a positive effect on a wide variety of tissue. That's the whole purpose of this presentation. So this is an acoustic wave. It's a three-dimensional fluctuation in the pressure field, and they travel at the speed of 1500 milliseconds. You got the sound coming from the speaker, ground movement from the earthquake, ultrasound, and all these are like acoustic wave. Okay, now you have the nice picture. You got shock wave, diagnostic ultrasound, and you got the radial pressure wave. Today we're just going to talk about only the shock wave, extracorporeal shockwave therapy, the nice red picture right there. And then it's a shockwave with intense, very short energy wave, traveling faster than the speed of sound. And again, we already said it's an acoustic wave. It carries a lot of energy, can propagate through the medium, solid, liquid, and gas also. So energy measurement, you can always think in the terms of energy flux density. There's low energy flux density and high energy flux density. So how does the shockwave application, like when we treat, main thing we have studies have shown extracorporeal shockwave therapy can decrease the pain in patient with the plantar fasciitis, lateral epicondylitis, tendinitis. How do they do that? So there's a when you talk about the pain mechanism, substance P is concentrated in unmyelinated C fibers and subpopulation of slowly conducting, lightly myelinated nerve fibers. And it released at the central and peripheral terminal and sensory noise deception neurons after the stimulation. So substance P plays a very important role in that. So what is the mechanism in the pain controls? A very important part is the substance P. It's concentrated in the unmyelinated C fibers. So when we do shockwave therapy, it decreases the substance P. Okay, we got a nice diagram over here. And also it causes the destruction of the unmyelinated C fibers also, which is very helpful in controlling the pain. Those are the two main mechanisms when we talk about it. Okay, now the other biological mechanism, it also has some other benefits also, like tissue generation, improved blood supply. Okay, so when you give this physical shock wave energy, there's so many biological response happening at the same time. First one is there's increased BMP, there's more bone morphological protein help with the bone repair. Okay, then you also have endothelial nitric oxide, which is very helpful in improving the blood supply and the angiogenesis. And then you have the vascular endothelial growth factor that also help in the improved blood supply and tissue generation. And then you have the proliferating cell nuclear antigen, which is PCNA, that is also providing increased blood supply and kind of promoting tissue degeneration, mainly neovascularization, and it also helps in tendon repair. So mainly it helps in bone repair and then improved blood supply, tissue generation, and the tendon repair, mainly through bone morphological protein, endothelial nitric oxide synthase, and vascular endothelial growth factor, and the proliferating cell nuclear antigen. Thank you so much for watching. We'll be back with another presentation. Please subscribe to our channel. Thank you.